What's going on, everybody? TG here again, and I got three amazing stocks that could really bump your portfolio up big, and I want to go ahead and go into detail on each and every one of them. Starting off first with CVM, also known as CEL-SCI Corporation. This is a stock that I've been holding for a long time, and the time is almost here. The do or die date, data release. We have been waiting for full data analysis for a very long time. Last May, on May 4th, they announced at the end of their trial for their Multikine drug. That was a 10-year trial, and it finally ended. And so they had to collect all the data and collect all that, and they're going to finally read the entire data out in the next couple weeks, hopefully. This is game changing if this data is good. And I'm telling you guys right now, it's one of those stocks where you're either going to 10 times your money or you're going to lose it all. And I just want to be completely open about that. If you guys notice, I have 300 shares of the stock, so $4,700 worth of shares, and also about $3,500 worth of calls. I'm playing it pretty risky. I'm risking about 10%, 8% of my entire account on this company. I've been there for a while. I truly do believe in it. If this works out and goes to where we think it will go, I will make a lot of money, a six-figure amount if it works out. And they believe a buyout could be about $300 per share. I think it'll probably be about, after data, if data is good, it'll go up to about $175 to $250 a share if data is good. But this company, it's about a $650 million market cap, as you guys can clearly see, or 637 market cap for CVM. And they basically work on head and neck cancer. So the goal of their drug is to boost the body's immune system before the standard of care. So before the operation, you're going to get a dose, a diagnosis before you have surgery and radiation and chemotherapy. And obviously, people would much rather have something than chemotherapy. If you guys know anyone who's been affected with cancer, who has had to have radiation or chemotherapy, it's not good. It's a very painful and very hard process. But the event, like I said, the event in this was a long study of 928 patients. It started in September of 2016, was the last patient that was treated with this drug. So 9-year trial, 9 years of having this trial go on. The final event happened. There had to be 298 people to die in this trial. So not 928, 298 people die in order for the trial to be over and they can start collecting this data. They've been collecting it for almost a year now. Like we said, May 4th was when this happened, and it is now April 13th. So we're almost an entire year of them collecting data. And if this works, it is going to be an absolute blockbuster drug. Kramer mentioned it, and he said if data is actually good, this is going to just absolutely fly. And we're going to see something that we've never seen before. A stock that is literally going to go up at least 10 times what it is. And obviously if it works out good, people would be inclined to buy this drug out. And big pharma is definitely going to want to get their hands on something so revolutionary because there's nothing in the market like it. If they get it, it will replace the standard of care, and it will be ginormous. So watch out for CVM. Put this on your watch list because any week now, any day now, this data is going to get announced. And if you want to take a risk and put a small portion of your portfolio into it, I recommend doing it. Like I said, you could lose a lot. You could lose everything. If the data is not good, there's no reason the stock exists. But if the data is good, which I believe it is, I've been in this company for 2 years now. I believe it will be. It is going to be revolutionary, and you are going to make a ton of money. The trial was supposed to end 3 years ago and ended last year. It lasted 2 years longer than expected. And I believe that is because the drug was so effective in treating head and neck cancer that it allowed the patients to survive longer. And a lot of other people believe that as well, including the CEO who talks a lot about that. So that's what I recommend if you guys want a risk. This is a great stock. But like I said, it's a hit or miss. You're either going to 10x your money, you're going to lose it all. So take that in consideration. Don't put your entire portfolio into it if you're, risking. But, they believe if this is good, it's going to be about, maybe even $300 per share. So that's stock number one. Stock number two is AMRN Corporation. AMRN has just been absolutely beat down. I feel bad. This company has just not had its day in the sun in a very, very long time, despite having amazing news a couple weeks ago when they got European approval to sell their drug in Europe, which is huge, groundbreaking. But unfortunately, that news was dragged down after the CEO today resigned or announced his resignation, and the stock fell 13%. I went ahead and took advantage of this and sold 8 LEAP puts in this account alone, as you guys can clearly see. So the stock's trading at $5. I believe it'll be above $8 by January of 2022. And I got paid like about $1,100 for it. So very bullish on this. And one of the reasons I love this drug is their drug is growing at a fast rate. It took an absolute beatdown about almost a year ago when when it was announced that there would be generic drugs in the generics had an opportunity to make the same drug that Amarin does, thus taking market share away from them in the US. But the good thing about Amarin, it also has drug approval in Canada and now Europe, and is now working on getting one in China. If it gets one in China as well, that is groundbreaking. We believe that this European approval alone is going to double sales at least. As you guys can clearly see, this stock has been growing a lot. Over the years, it's just been having amazing growth in the company, getting to finally to profitability, and is now just continuing to grow big. You're talking 167 million revenue last quarter alone, and this stock is only valued at $2 billion right now, only $2 billion exactly. So there's a lot of room to grow. And like I said, this company was a $20-something company for a long time. I actually owned it back then. Took a big beating on it, but it's one of those things that happen. But I like this company a lot. It's been absolutely thrown through the gutter, put through the ringer. But I think this is an amazing opportunity to get Amarin at a very, very cheap price because, like I said, this drug is just growing. And now that they have European approval, which is a big catalyst, that's huge. And, I expect the stock to be at least in the 8s by next year at minimum. So if you guys want to take an opportunity on a nice pharmaceutical healthcare company like Amarin, this is the one you do. It's very cheap. It already has its drug approved. It's already making sales and is very, very dirt cheap. So I like Amarin. I'm glad the CEO stepped down. He really wasn't inclined to being bought out either when companies did want to buy them out. So hopefully maybe the new CEO will be inclined to do that, or maybe he'll just take it and really grow the company and be more vocal about it. So either way, it's a great company, and I definitely recommend getting into it. And the third and final one is SESN, Sesen Bio. They have a big catalyst coming up very, very soon. It's an extremely volatile stock, so be warned about that. But they have a potential drug that has already passed its phase 3 trial with ease. And if works, their drug, Vicineum, is going to be a blockbuster. It's writing an upcoming approval that we believe it will get. And if it does get it, this stock is going to fly. Another, like I said, biotech company working on bladder cancer and bladder issues. And I believe this company is going to absolutely rock it. Like I said, they deal a lot with bladder cancer, which is obviously a big growing issue in the U.S. and other places like that. And it's a big market. It takes up the 6th spot for the most common cancer form in the U.S. in 2020, and there were 81,400 new cases with 17,980 estimated deaths, with bladder cancer being the most expensive cancer to treat, with the market size easily to grow roughly $6 billion. So it's a big business. It's a big market, pardon me. It's very expensive to treat, and Vicineum is a cost-effective rather than your standard of care, thus making it more likely for people to use it rather than the other ones. Vicineum treatment would save over $101,000 by year 5, no matter how you look at it. It's a quite significant savings for the patient. Patients are going to be more optimistic and, more inclined to use something like that. So I want to talk about, the potential risks. Obviously, if they don't get approved by the FDA on August 18th for this, the stock will tumble hard, at least 50%. At least 50%. And they believe there's about a 30% chance for non-approval. I think there's about a 25% chance. But, in all, it's a buy, in my opinion. 4 out of 5 star rating. And, the possible pipeline of, this huge drug. And like I said, it will be a blockbuster if approved. And again, it's one of those risks. It's a gamble almost, because if the data is good, the stock's going to absolutely soar. But if the data is bad, the stock's going to absolutely crash. So you have to take that risk. It's a good way to, potentially make a lot of money, safer than something like roulette, with people and scientists that have backed this thing for a while. So I believe shareholders will enjoy many good days ahead. And, I think that this is going to be good. I think this is going to be very good for the company. We've seen a very, wild move. This thing was under $1 at one point, soared all the way up to like the 3s, and then kind of fell back to 230s. So we'll see what happens. I still remember buying the stock at 60 cents, selling it at $1, buying it $3, selling it at $1. I was such a noob investor back then, but these are 3 amazing stocks that you want to have on your watch list. So again, CVM ticker right there, AMRN ticker right there, and SESN. Put these on your watch list, and you guys will see they're going to have big moves very, very soon. You want to take a little risk on it. 5%, 10% of your portfolio, put into one of these things. I definitely recommend it, but I'm not a financial advisor. But anyways, guys, have a wonderful day, and I will see you in the next video. Bye.